Observing the room. I'm going to gather my equipment. I have my stethoscope, my Q-tip, gloves, hand sanitizer, tongue depressor, wash my hands, knock on the door, provide privacy. My name is Kirsten. I'm a CVCC nursing student. I'll be doing your head-to-toe assessment today. Can you confirm your name, date of birth for me?
July 3rd.
Do you have any allergies?
No.
And are you in any pain?
No.
Vital signs are 120/80. Heart rate is 72. Temperature is 98.6. Respiration is 16. Patient's appearance is dressed appropriate. No profound body odors. No pain is reported. Patient's lips is symmetrical, pink, moist, no drooping. Do you know where you are today?
Hospital.
And the date?
Today.
What date?
The 14th.
Okay. And do you know the year?
2024.
President?
Kamala.
Patient is alert and oriented ×3. Cognitive abilities are intact. Patient answered all the questions appropriately. Posture is erect. Patient is relaxed and mood is appropriate for the situation. Face shows no sign of pain or anxiety. Speech is good with no slurring. Now I'll be moving to your head and your face. There are no signs of bumps or lesions. Appearance of hair is evenly distributed. No lice. Face is symmetrical with no color variations. I'm going to touch your face and your temple arteries. It's good ethnicity and tenderness. Facial skin is warm, dry, and intact. Can you smile for me? Frown. And show your teeth. Blow out your cheeks, rose out your eyebrows, and close your eyes tight. Cranial nerve 7 is intact. I will be grabbing my Q-tip now. Close your eye and whenever I touch you, let me know where you feel it.
Forehead. Cheek. Cheek. Chin.
Patient cranial nerve 5 is intact. Now I'll be assessing your eyes. Eyes are round, equal, and bilateral. I'm going to pull down your eyelids and inspect your conjunctiva. Conjunctive is pink, moist, with no lesions. Now I'm going to grab my pen light. Patient's pupils is a size 3 and pearl is intact. Now can you follow your pen light with your eyes without moving your head through all 6 gauges? Cranial nerve 3, 4, 6 is intact. Now I'll be moving to your ears. Yeah, this is right. I'm going to inspect and palpate the articles, which is in front of the ear. Tragus, lobial, and mastoid process. Everything is soft, symmetrical. Size and shape is appropriate with no lesions or drainage. Now I'm going to palpate the pre-auricle, the post-auricle, occipital, the cervical, the submandibular, submental. Lip nodes are non-tender with no masses. Now I'm going to test your hearing. Let me know what you hear on both heads. Soccer. Football. Patient has good hearing bilaterally. Now I'm going to move to your nose. I'm going to inspect your nose. Nose is midline and symmetrical with no discharge. Now I'm going to touch your nose. Patient has no tenderness. Can you press down on both sides for me? Patient breathes freely through both ears. Now I'm going to wash my hands and put on gloves. going to inspect your teeth. Teeth is white with no visible decay. Open your mouth for me. Gums, buccal, mucosal, soft palates is pink and moist. Uvula is pink lined. Tonsils are pink. Now I'm going to access your gag reflex. Gag reflex is intact. Can you stick your tongue out? Up and down, side to side. Tongue strength is adequate and cranial nerve 9 and 10 is intact. Now I'm going to move to your neck and inspect the appearance. Neck is warm, dry, and intact. I'm going to palpate your trachea. No signs of tenderness. I'm going to have you move your head from side to side, up and down. Range of motion is intact. Now I'm going to palpate and observe your JVD, no jugular vein distension. Okay, I'm going to palpate and auscultate your aortic arteries. Two plus equal bilaterally. I'm going to grab the stethoscope so I can listen to your heart. Oh, 1 second, sorry. Stuck in my hair. Oh my gosh, okay, thank you. Okay. The aortic area. Pulmonic. The urn. Tricuspid. Then the mitral. No abnormal heart signs were heard. It's regular. Now I'm going to inspect. And palpate. And the PMI is palpable. Sorry. Now I'm going to palpate. It's tender, warm and dry, no lesions. Now I'm going to percuss. All percussions are zonded and throughout. Now I'm going to auscultate. Sorry. No abnormal sounds are heard. And can you sit up for me so I can look at your back? I'm going to inspect her interior post wall. Everything is intact, and she isn't using everything is intact, and she's not using any accessory muscles to breathe. I'm going to palpate. No signs of tenderness or masses. Now I'm going to percuss. All percussions are resounded. Now I'm going to auscultate and have you take a deep breath and let it out. No abnormal sounds are heard. Bones are equal bilaterally. Now I'm going to test your shoulder and stroke resistance. Good resistance. Cranial nerve 11 is intact. May I see your hands? Pull up and down for me. Okay. Bilateral grip strength. And now I'm going to feel your arms and hands. Capillary refill less than 2 seconds. Pulse is 2 plus equal bilaterally. Radial pulse. Brachial pulse 2 plus equal bilaterally. Now I'll be moving to your breasts. Breasts are soft with no tenderness, lesions, or masses. Now I'm going to teach you about the breast exam, best time is after your menstrual cycle, a week after. And you can do it in the shower or standing in the mirror. Just make sure you start at the outermost area and go in a circular motion without taking your hand fully off, making sure that you cover the whole surface. Wipe and pinch the nipple and check for discharge. You can always call your doctor if you ever feel or see anything abnormal. Now I'm going to move to your stomach. Lean back for me. There aren't any visible masses or distensions. I'll start by auscultating. In the lower right quadrant, the upper right, the upper left, and the lower left. Vowel sounds are normal and present in each quadrant. I'm going to percuss in the same order. Hollow sounds are present. I'm going to palpate. Abdomen is soft. No tenderness. Now I'm going to move to your legs, feet, and toes. I'm palpating. Skin is warm, dry, and intact. I'm going to palpate your finger pulses, the popliteal, the post-tibial, and the dorsal pedal. Pulses are 2 plus equal and go laterally. Move your feet up and down in a circle for me. Patient has good strength with active motion. Okay. Capillary refill is less than 2 seconds. So now we'll verbalize. Hair is evenly distributed. No infestation present. Skin is intact. Vaginal and labia is symmetrical and no sign of discharge. When was your last bowel movement?
Yesterday.
Okay, that's good. Rectum is intact, no signs of inflammation or lesions. I'm gonna have you stand up for me and bend over. No signs of spinal curvature. I'm gonna have you walk forward. Patient has a normal gaze. Heel to toe. Patient maintain balance smoothly. Oops, sorry. Okay, I'm gonna wash my hands and document.